I'm Kyle Celine Dorado, your first ever Mutya ng Pilipinas Pampanga 2022. And I am here again returning to CSA because as much as I love and live for my jawline, I naturally have a less feminine visage because of my face shape. So I am here to get the treatment done, of course, by the best doctor, a stellar Dr. Contessa Salvador Alapag, and also for a more radiant, young-looking type of glow. They're also going to treat my genetic eye bags, and later on, they're also going to enhance my chin for a more proportionate look, since I also happen to be around or in front of the camera a lot of times, as I am also a reporter, a newscaster. So abangan nyo ako as I get those treatment. I'm very much excited and exhilarated. So yeah. So don't forget to click and subscribe, the subscribe button down below, Dr. Contessa Salvador Alapag on YouTube.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have with us our reigning Mutya ng Pilipinas Pampanga. Let's all welcome Miss Casey.
Hi,
Casey.
everyone.
Welcome back. So in the past, we did non-surgical procedures for Casey. We had nose enhancements. We also had like under eye treatment. We also had chin enhancement and like contouring of the face, right, Casey?
Yes.
And she's still looking so young, and her face is really beautiful, okay? And her skin is, wow, so excellent. Baby skin, right, Casey?
I'm maintaining it, Doc.
Yes, there you go. So now, actually, Casey is also preparing for a national event, right? A national competition. And it's very significant for them to do further contouring and enhancement on their face to prepare for that very big event. It's a national competition. It's something heavy also, right?
Yes,
Okay.
Mutya ng Pilipinas.
Correct. There. And we need a further treatment to still contour the face and balance or make the face symmetrical and harmonious, okay? I was doing an assessment on Casey a while ago. Actually, I was like doing the proportions of the face, upper, middle, and lower third. What's like more of a part of the face that she would need a treatment on will be the lower third, because I was touching the sides, this part here on the lower third, the angle of the mandible. Well, I was telling Casey that we have dominant masseter muscle here. Okay, right, Casey?
Yes.
So making the face look like a bit of squarish, right? And wider here. The so-called bigonial width, it's really wide. And we were like discussing that for a female face, an ideal shape would be like a narrow bigonial width. Okay? And then looking at the jawline here, actually she has a young jawline, okay? She's still so young. 20? Yeah. And it's good. So there's no jawline there. There's no irregularity, no loss of definition, no volume loss yet. So for her, we're highlighting only the beautiful parts of the face. It's enhancement and it's more beautification. And then as I look at the chin part, I notice that there's still an insufficient length. So more of the vertical dimension. If you check on the anterior projection, it's fine, but it's like she has a shorter chin. If you look at her frontal view, okay? Even on the profile view, if you check her profile view, you'll notice that it's still short and you have like a level of your mandibular line here. The mandible line here is like on the same level. We wanted it to be like still like the inverted triangle or the V contour. And we wanted to make this slimmer and we wanted to still enhance the chin. And in addition to that, our constant problem is the under eye region, right? Yeah.
Eye bag.
Yes. So it's a concern for Casey because in the past we did under eye filler for her. It's due for injection again because I noticed there's again sunken under eye or the infraorbital hollowness or the tear trough region. So we need to correct that again because if it's gonna further become like sunken or more hollow, and then it's gonna give you that tired look, haggard. Okay, so laging puyat daw si Casey. There you go. And in addition to that, I was touching the temple a while ago. There's volume loss in the temple region. So part also of our Enchanting Eyes treatment, we do the temple, we do the under eye. We'll be doing a periorbital rejuvenation as well as the V contour, the perfect V. We'll show that when CSA Medical Aesthetics return. And we're back. So we're doing the so-called perfect V for Casey. Okay, I'll be starting on the chin part here. So the center first. And then after that, I'll be doing the masseter. I'll be using the Guillaume for relaxation of the masseter. And then I'll be combining it with the Ultherapy, our device for face slimming as well and lifting and contouring also. Okay, for the chin, I was mentioning a while ago that looking at the frontal and profile view, you'll notice that there is this like in terms of the vertical dimension. We need to improve that vertical dimension because there's this 1/3, 2/3 rule. Okay, so for our chin improvement in that aspect, okay, so we need to work on the so-called labiomental crease and at the same time with the chin apex. Okay, because she already has a good volume, right, Casey? There's already a good projection. We just wanted to enhance in the length part so that we'll have a good V shape here. Okay, so for that, if you want to work on the labiomental crease, if you want to make a marking, okay, so center wise, this one a vertical line there, and then on the corner or commissure, oral commissure, a vertical line, the other oral commissure, a vertical line, and then make a horizontal line. So the center of this, divide this section into two. Okay, so we have here this part here that we want to improve, the upper part of these two divisions. Okay, we wanted to fill in this area here, this part here. Okay. And then after that, I'll be working on the so-called chin apex, just this part here. I'll be filling in this part here and be filling in this part here on the upper part. Okay, I don't want to give her too much of the volume already. It's just more of the improvement of the length of our chin. Are you ready, Casey? We've done this before. So it's like how long ago have we done it?
About a year.
Oh, yun. Okay. So for Casey, I'll be using a product called the Radies, the calcium hydroxyl apatite. It's a very good brand of a filler. It has like calcium hydroxyl apatite and it can last longer, and it's also a biostimulator. It helps in buildup of tissues, collagen, and other protein materials in our tissues and skin. So I'll be using a cannula. So I'll make an entry point on the lateral aspect here of the line that I drew from the right oral commissure to the mandible there. Like for example, if you have a gauge 25 needle, you can make use of a gauge 21 or gauge 23 needle for your entry point injector or introducer. Okay, so you can do like a rotation of that one so that you can actually insert your cannula into that tiny opening, and then you just glide towards your labiomental sulcus there. So labio, the lips, mentalis is this part of the chin. Okay, you will just glide there. Okay, so Casey will just be relaxed. This one has a lidocaine, Casey. It will help us in like having some numbing of the tissues there. Okay, so just glide. So technique is to do like an upper layer there and then a lower layer there. You're gradually introducing your product, gradually, slowly. So this is like a semi-fanning technique. Some areas with some resistance there. Introducing again. So as to the amount, it will depend on the needed volume. Case-to-case basis, you can use like a 0.5 to 0.7 ml in this side here. So like we'll try using a 0.7 here just to improve. Okay. Gradual and gradual and gradual and gradual. Okay. And then to that fold there. Okay. You okay, Casey? Okay, thank you. She's still speaking to us. Okay, you can use that amount. And then after that, so I've done the right part of the labiomental crease there. Let me work on the chin apex there. So I'm using the same entry point again and direct it to the sulcal symphysis menti there. So just a straight linear method here. So like a bolus technique for the apex. So for the apex, you can use 0.2 to 0.3 on this right side here. We will be doing the opposite side later on. So this is just like a bolus. You just do a bolus technique here. So that's a 0.2. So again, the goal is to elongate the chin. Okay, let's proceed to the left side. So make your entry point again, pinch the skin, and then glide, or rather make a circular motion for your needle. And then I have this cannula here, and I'll direct it again to that labiomental direction. Okay, make your gliding like an upward and a downward stroke. So we have done chin using our radius. Now I need a Xeomin to work on the masseter there. Let me finish on my injectables. Then after that, we'll be doing our Ulthera for the V contour, perfect V. Okay, so palpate for that masseter. Casey, clench please, bite. Okay, and then I'm just gonna directly inject into that masseter muscle there. You can use like at least 30 units per side. Case-to-case basis, there are ones with stronger and bigger masseter muscle. You can add more. Okay. So the left side, you can use 30 units, and then the right side, you can use the 30 units also. Bite. So again, avoid the very anterior portion of your masseter to avoid the risorius muscle, because that muscle is connected to the anterior border of the masseteric muscle. Okay, let's proceed to our Ulthera. So part of our perfect V is the Ulthera treatment. So we have the Ulthera device for also targeting our dermis fibroblasts to stimulate collagen for lifting and tightening. And it's also targeting the subdermis, the subcutaneous fat layer, so that there will be contraction of the subcutaneous fat, and it reaches up to this mass layer for contraction of that musculoaponeurotic layer. Okay, Casey? So I have my device here. Casey already had Ulthera in the past, right? So you had experiences already, so you already know the feeling. So I'll work on the right side first, okay? We have procedures whereby we have the so-called customized treatment for every individual. So we don't have the same face, we don't have the same shape of the face, we don't have the same volume and amount of tissues inside. So you can customize, you can like do your own number of shots for every part of the face. Okay. So we're working on the first part here in the lower and middle third. So we'll make a line there. Okay. First shot. You're okay, Casey? Okay. Just like a tingling, right? So for me, the best ultrasound device for aesthetics will be Ulthera, okay? So since it's very precise in terms of showing us the depth of the tissues that we're targeting, you can see in your screen where you are already, where your shots are being delivered. So if you're looking for an energy-based device, it's very safe and very precise, very accurate, the Ulthera will be that device for you. So in terms of safety, precision, accuracy, and of course, effective results, then Ulthera is the best. Okay, so we'll be giving Casey multiple shots all over the face, since I'll be doing also the so-called Enchanting Eyes. We'll be doing also around the eye area, upper third of the face we'll be working on, middle third, and the lower third of the face. And I'll also be giving her shots submental, because I'm noticing already like they call like a beginning sign of double chin, Casey. Don't want to even say double chin. It's just like a sagginess of the tissues under the chin. Probably Casey's overworked, so we want to prevent aging already, right, Casey? You're 20, and then they're saying that prevention is better than cure. So you're just doing prevention, right? Yeah. And the good thing with Ulthera, since it stimulates your fibroblast cells, it's gonna also improve further your skin texture. So you're maintaining that closed pores. Casey has really closed pores, right? So after the Ulthera, we'll do on Enchanting Eyes, then we're good. Now, as part of the Enchanting Eye treatment, we do also filler for the temple and also filler for the infraorbital region. Okay, so with Casey, I noticed there's already volume loss in the temple region. She's just 20, okay? So some people with like in that age may already start to notice some volume loss in this region, okay? And then when you go infraorbital, below the eye area, you'll notice sunken under eye. Okay, so we will correct that non-surgically using our fillers. So for the temple, I can also use Radis here for my temple. She's young, so we want to do biostimulation for her. I can use my Radis dermal filler to improve the temple here, and also part of the V contour, the inverted triangle of youth, is the temple also, okay? So for this part, you palpate for the temporal fusion line and also the lateral orbital rim. Then you can locate for your entry point. So my entry point will be at the tail of the brow here. And I have a Radis with a needle, and then just direct that into the tail of the brow onto the bone. There you go. I'm already onto the bone. She really has thin soft tissue layers here, hence that like sunken temple already. And then I'll be pushing like a bit of my Radis here. For example, I'll just use 0.5. Okay, again, Radis is a strong filler. It's thick, it's viscous. Okay, so when you push it gradually. So I'll just be using a 0.5. And the good thing with this one, it has a lifting effect on the corner of the eye as well as the lateral eyebrow. We also use this for lifting the eyebrow tail as well as the corner of the eye. And also correcting the volume of your temple will improve the overall shape of the face as well. Okay, this is also used for contouring. You're okay, Casey? Yep. Some discomfort from the needle there. Okay, so vessels you have to avoid here, the so-called STA or the superficial temporal artery, and then also avoiding temporal vessels there, like your middle and deep temporal vessels, okay? So for doctors, they know the anatomical layers and those anatomical positions of your blood vessels. So just being careful in pushing this, doing this kind of technique, okay? So it will depend on the needed volume in the area. Sometimes I use just a minimal amount or like a 0.5. So we'll see with the 0.5 already. And then after that, we'll just do a massage, okay? You're good? So we're done with the right temple. And then let's do the left side. So proceeding to the left temple, okay? So again, the goal is to fill in the sunken or hollow temple here and also lift the corner of the eyebrow as well as the corner of the eye, okay? So your land markings, 1 cm lateral to your temple fusion line and 1 cm superior to your lateral orbital ring. So you can follow the markings. An insert video is being seen or like shown right now. Just follow those markings, okay? Sometimes you'll notice that they have this sentinel vein and you have to avoid that sentinel vein as well. So on to the bone, okay? So our target is the bony layer here. Inhale, exhale lang, please, okay? So I am onto the bone. So this is supraperiosteal. So for our under eye, okay, I'll be using the cannula method here. So again, for demarcations, okay, make a vertical line from the lateral canthus, vertical line, and then from the ulnar groove, a horizontal line, and the intersection line. That's gonna be your entry point, okay? Just a prick, okay, see? And then I'll use for her my Belotero Soft. She has thin skin under the eye, so I wanted a very thin filler as well. I'll start filling in the middle aspect here of the infraorbital region, okay, this part here, before I go to the teardrop, okay. So she really has thin skin and we wanted to improve the skin under the eye also. And then I want to improve the lateral canthal region to give that lifting effect on the corner of the eye. Again, as part of the Enchanting Eyes, if you want the eye area, the corner of the eye, to be lifted, okay, some pressure, Casey, sorry. If you want this to be lifted, if you really want to open the eye area, you can also fill in the lateral canthal region, okay. And you may want to use a 0.2 mil here, a 0.2 mil there. And when you go to the tear trough itself, you only want very small amount of your product, of your Belotero Soft there, because the tear trough really has very thin layer, and if it's very thin, you just need very thin material also, because you don't want to have that bulging under eye or like an eye bag effect already, okay. And take note that we wanted to have smooth transition of that lid chink junction, okay. Just a 0.1 mil here. And this is a hydrophilic material. It absorbs water. So you only want small amount. Okay? There you go. Because in a week or two, you'll have that attraction of water and you'll see that patient may come back to you having again an eye bag or a worsening of the eye bag, thereby because of the created sausage-shaped bulge on the tear trough region because of the too much filler. So when it comes to the under eye, when it comes to the skin directly under the eye, the lower eyelid region, just use tiny amount. Less is more in that area, okay? So temple, chin, cheeks, you can use as much as you want, but the under eye skin is very thin. We want only small amount there. We do not overcorrect the skin under the eye, okay? Especially the tear trough there. And considering Casey has very thin skin already in this tear trough region, the medial aspect there, next to the medial canthus. Okay, entry point again, pinch, then your needle. For other doctors, you do your circular motion so that whenever you insert your cannula, it's gonna be easier for you to enter there. And then I don't directly start now at the tear trough. I just wanna correct first the middle part before going to the medial aspect, okay? some pressure, Casey. And then the ideal anatomical layer here right now is submuscular or beneath your orbicularis oculi muscle, okay? You may want to fill in at the medial or suborbicularis oculi fat pad, that's fine, but don't be very superficial here right now to avoid those so-called tyndall. For you to avoid tyndall, do not be very superficial, okay? So I'll inject towards the lateral canthus, okay? So some of you may have an idea what a tyndall is. It's like a bluish discoloration under the eye area created by that particle of your hyaluronic if it's inserted too superficial. I can now fill in that tear trough beneath the medial canthus there. So I'm already in the left medial canthal region, infra-medial canthus. Okay, a little bit of filling in there. And then usually we tell them to come back after 2 weeks to check again the under eye skin if we need to add a little bit more. So we have done perfect V as well as the enchanting eyes. Okay, to summarize, so for the perfect V, we did the chin radius, the masseter, Xeomin, Ulthera. For the enchanting eyes, we did the Ulthera, and then also your temple filler, under eye filler. So we made use of Belotera Soft here, we made use of radius filler here. Actually, Xeomin or your botulinum toxin is also added for the enchanting eyes. We can also do a little bit of a baby injections here later on. So we'll show the result to Casey when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Casey. Casey, here's our mirror. We did perfect V as well as the enchanting eyes. So we have now Casey looking at her face, and I think she can see an instant result of contouring as well as enhancement. Casey, what do you think?
Doc, it's actually my first time trying out the enchanting eyes.
Yep.
Especially like the temples of my eye here. I don't actually notice it, but everyone seems to notice that I kind of look like a corpse right now because the structure of my face is like parang skull po daw.
Yes.
So ngayon parang nakita ko yung improvement.
Right.
Mas mukhang parang yung aura is like glowing bright.
Glowing, yes.
Happy
Exactly.
eyes.
Happy eyes already, not yung puyat look. The other saying not tired
and
look.
I don't look like my age before because of my eyes that's deep set. Now I'm starting to look a little less tired and a lot like my age.
Yeah. Imagine that we filled in the temple region and it really lifted the corner of her eyes. Plus we did soft filler only on the under eye region. It's like a proper blending of the products that we have used, and we can see an instant result already. You can even have a party tonight or go on a date. Okay. So wala muna daw date for Casey.
No
Career
dates
muna.
pa.
Exactly. And I also love the improvement of the chin region. There's already an instant result. You can see already like a lengthening, an improvement of the vertical dimension of the chin, and it improved the proportions, upper, middle, and lower third. If you do measurements there, there's already a balancing and also like a symmetry of the face. And with the Xeomin masseter, of course, we still wait 2 weeks for that, as well as our Ulthera procedures, we still give time for it. Like 1 month, 2 months, 3 months, you'll still see lifting and further contouring of the shape of the face. There you go. Thank you, Casey.
Thank you so much for Doctora. Magic hands of the Contessa.
Thanks for trusting us. I have one special question for you, Casey. Just give us an opinion, okay? Why choose non-surgical over surgical procedures? What is your opinion on that one?
Well, for me personally, you don't have to really undergo like a scalpel just to achieve the face or like the features that you want to achieve. Especially for me and my age, I'm only 20 years old, and I think that it's safer, and at the same time, if you do want enhancement in your face but still maintain the natural features of your face, then non-surgical is the way to go for it.
Very well said, Casey. Thank you so much for that opinion. Yeah, A lot of us will just want natural result. They don't want to alter their anatomy. Again, others are still afraid of the knife, the scalpel, okay? And others still don't want to have that general anesthesia. And others are, yeah, they're still young, so they just want something non-surgical. Okay, thank you, Casey. Okay?
Thank you so much po, Doc. And I would just add po, syempre, if you're going to like undergo non-surgical, please choose like the best doctor, the best clinic. It's okay if it's going to be a little bit pricey, just so you know that you're safe and you're in good hands.
Amen to that. In addition to that point also, like others are like comparing prices, okay? Now, in terms of like payments for the treatments, it will vary on like what is the product that we use, what is the brand, okay? Because like fillers, there's so many brands of fillers, but we use the best brand, the brands that were scientifically studied and they have FDA approvals. And also another thing, it's the skill of your injector. How long has been your injector doing it? How many procedures have they done? So it's a matter of like how well versed your doctor is, how confident your doctor is, how long have they been doing it, and how many like conferences have they been doing, especially if your injector is one of the global trainers for other doctors. So like if you want cheaper brands, we can give that to you too, okay, so that to minimize the price. However, whenever they ask us questions kasi, we always give the high-end, the high-end brand, the most expensive brand. But kindly let us know if like, Doctora, my budget is this, so we can do something about it. Let's work it out. We'll also help you with that, okay? Thank you so much. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please also watch the other episodes of KC, where we did other procedures on her. Just look at our YouTube channel, Contessa Salvador, and also subscribe and also click the notification bell to keep you updated. Okay? So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.